And I need to get the presentations in. Does anybody have an objection of not having lab today?
I don't think you'll hear a single complaint.
You're good. I gave my presentation. I'm doing my part.
And I shared mine with you, so I did mine.
Yeah, so some people needed to present today because of other things. Who's in that list of presentees? Hers?
No clue. I'll present if you
No,
want to have my chair.
Somebody who sent me an email.
If we have anything to do for labs,
Were you presenting today? You're presenting today. You're presenting.
Did we have anything due for lab? Because isn't today our last meeting?
Oh, thank God.
Are we just done? Like,
Yeah, no, there's nothing left in lab. The only thing that this is the last thing in lab, these presentations. Presentations have nothing to do with lecture, they're strictly about lab.
Okay.
So they're just the completion of what you're gonna basically all get in lab.
Okay, so we present and we're done.
Nothing else we presented, we're done. We have nothing else to do in lab.
That's correct. Can you handle it?
Yeah.
I have a lot to do. I've got tax day stuff. I've got forms and everything to get sent in. So all of those just arriving, and we just need to get are you ready? We have today, Wednesday, and Friday here to get the presentations done. Let's get them done. Okay, so there's no lab. I will be here probably for an extra hour or so, trying to get some paperwork done before I leave for today. And then, what else? So I just need to get that type of stuff done. And then if we get all the presentations done, then I will just do the review as part of, whenever we're done with those. If not, I'll have to do it separately. Because the final comes pretty early in the finals. You come right away on Tuesday.
Did you say it is on?
Yes, I did say it is on.
Okay, that's what I thought.
Try to restrain yourselves.
I know the excitement's gonna kill me.
Yeah, I know it's going to kill you. It's whatever day that is. Yeah, I trying not to be around.
Yeah.
This is when I try to make myself. I have to get ready. As soon as week after finals, I probably start teaching micro again.
Oh, you do summer as well.
I have 2 labs and a lecture.
Can we make you told us your birthday. Can we come in for your birthday?
I will. You can, but I won't be here.
Okay. It's Wednesday, May 10th.
That's correct.
You said that, so I wrote in my.
Yeah, I actually probably have a lab that day, but I'm going to be conducting that lab from sunny Orlando.
Oh yeah.
Dr. Stein, where are you going to be June 30th?
Where am I going to be June 30th? I'll be local.
Okay.
That's a Tuesday.
That's a Tuesday. I'll either be teaching here. Why, is that your birthday?
I'm getting a party bus. We're going bar hopping. Me and Faith. You're invited. You're coming on the party bus.
We are going on a party bus.
Yes, we are.
I do like working here.
I won't have any more classes with you. Well, I won't be your student anymore.
Isn't that?
Yeah, you're still an undergraduate. There's a fine line that I can't cross.
Okay. Next year.
You're going to be in the. Oh God. That's right.
Wait, so Dr. Stein, once we graduate, can we all go on a party bus?
Yeah, we're going to the Bamboo Bar behind North Park Lounge.
I know right where that. I know exactly where that.
Okay.
He's probably been there already. I told you that story ages ago with my daughter. Okay, my boys were 22 and 21. My daughter was 19. And so right after Thanksgiving dinner at home, they were all getting dressed up, ready. Where are you guys going? Oh, we're going to go on the south side. So I said to my daughter, you're only 19. She goes, Dad, don't worry. I said, oh, you're not going to drink? She goes, no, I have fake ID. It's okay. I got it covered. My daughter? Yeah.
I've seen the pictures of the Steelers game. I've seen the tailgate pictures.
With my daughter?
Yep.
Whoa.
Like she basically just.
So she's more settled now.
Okay.
Whereas now I have to worry about the one who's your age, my granddaughter. All right. Who wishes to begin?
Who wants to go?
Who wants to go first?
Yes.
Hey, did you send me your stuff, right?
Yeah, you emailed me back.
Cause in the middle of
When
the,
did I email you it? When you literally got like a nice 4-page thing.
I don't even hear. So you're gonna, this is yours, go ahead.
Okay.
I'm moving, I'm leaving. See you later, have fun, son.
Should I sit like how you
You can
sit?
do whatever you want.
I think you should.
Oh, this is nice. No wonder why you're. Okay. So I did mine on Stevens-Johnson syndrome. Has anyone ever heard of that? Okay, you don't count.
I've had a patient with it.
So basically, it's a rare skin condition that requires immediate medical attention. And it most commonly is caused after taking certain medications like antibiotics or NSAIDs. It's also referred to as toxic epidermal necrolysis, even though they're kind of different things. And basically, it causes your skin to develop rashes, blister, and then peel. And it also affects mucous membranes like your eyes and mouth. So basically, it normally starts off as just a rash, just looks like you're breakout in hives after a reaction. But then you get skin pain, fever, body aches, cough, blisters and sores, peeling skin, excess drooling. Your eyes can even seal shut from like the burns on your face, and painful urination. So basically, they diagnose it by looking at your skin and mucous membranes. If it does affect your mucous membranes, it's typically going to affect 2 of them, like your eyes and your mouth. And pain level also, because obviously if it's just hives and they're not painful, they don't really think it's Stevens-Johnson's. And they also look at how fast and how much your skin is affected. If it gets worse very quickly, then they're going to suspect it's this. And they also do a skin biopsy. And the first thing they do is just make you stop your medication. And they'll give you fluids to replace your electrolytes, and also like morphine if your skin is pretty much falling off. They also will use antibiotics to treat infection, which is kind of difficult because obviously if the antibiotic is causing it, then that's a whole other issue. And basically it will cause your skin to literally have like 3-degree burns. So then you have to treat the burns. That's it. Killed it.
Yeah, it's interesting. Like I said, I had a patient with it, and I've seen it as a resident. So if in the world of medicine and in life, is if you see a thing that's ostensibly not common, you see it every so often, it's more common than you think. And so it's something that a clinician, for those of you who are interested in medical fields or want to go into them, that's it's in the back of your mind is when somebody comes to you and say, you just gave me this, whatever, typically antibiotic, and now my mouth feels funny and you're sore, then you start thinking about that right away. It's probably it's some unusual response that's mediated probably by your immune system. And the one case that I had was comparatively mild that I had to treat. So it was just stop and then local care as opposed to caught it very early. The key is this.
Yeah, well, I was misdiagnosed with this.
Oh, really?
Yeah. Because I took Spectrum and I'm allergic to sulfur drugs.
So you just had the allergy.
Yeah, but then I was like broken out into hives everywhere. And then I had like hives on my tongue. So then they sent me to West Penn.
Right.
And then they were like, no, you don't have that. And I was like, good, because I looked it up and if my skin falls off, I'm going to be mad.
You can get this from NSAIDs?
Yeah,
Why?
It's immune system doesn't play favorites.
I'm scared.
no, I'm no more
NSAIDs are not
ibuprofen.
innocent. Okay.
Tylenol is.
Right.
Tylenol.
It's not an NSAID. That's right. And Tylenol is not an NSAID.
I think I got it. I'm strapped.
Yeah, what I'm saying is, let me explain to you. The leading cause of fatal liver disease and early liver transplants in children, Tylenol. Tylenol is highly liver toxic. You should not, even as you and I as adults, should not take any more than 2 double-strength Tylenol 4 times a day. And if you do it for more than 2 weeks, you better get tested. It's highly. Did you ever wonder why they give it to little kids with the Tylenol, have the bottle that has the cherry and the grape that only has 4 ounces? You can't go to Walmart and get the gallon size.
Yeah.
That's wrong. My kid did it. My middle one slugged it down.
What?
4 ounces.
I see.
I called the poison center. I had to induce him vomiting, which he used to do way back then. I mean, so he got
How did you do? Did you?
Hydrogen
how did you
peroxide?
induce vomiting?
syrup of ipecac.
Oh.
Which normally they frown on you doing because it can, if something caustic, it could cause more good than damage.
God.
We knew exactly what it was. Because
Yeah.
I saw the bottle and it's that's my error.
Gotcha.
It's like that. And so that's the misunderstanding about time. Now, if you're talking about vis-a-vis as an adult, it's rare that you take Tylenol that long. But yeah, NSAIDs are not anything but aspirin and ibuprofen. 70% of people take them long-term, get gastric bleeding.
Kennedy, where are you?
That's why I cut myself off. I was taking too many.
Yeah, it affects your kidneys very adversely. Well, who are you looking for?
Kennedy.
There you are. Up next, come on. Join the party.
Yay.
Thank you
This chair
very
is-
much.
I really like this.
You can take it home. I will not say anything.
How do you make it a slideshow? I don't know.
Where it says, doesn't it say,
No, why is it in the dog?
doesn't do it.
Can I just do it like this?
You do it any way you want.
Okay. So I did my presentation on blood types. What makes up our blood? Red blood cells. Obviously, they're the most abundant. White blood cells, plasma, and platelets. And then genetics of blood types. Your blood type is established before you were born by specific genes inherited from your parents. You inherit one gene from your mother and one gene from your father. These genes determine your blood type by causing proteins called I don't know how to say that.
Agglutinogen.
Agglutinogens to exist on the surface of all of your red blood cells. And this is a nice little chart of all the different blood types and what antigens that they have in them. And then blood transfusions. It's a procedure that you're given blood through an IV. It may be done to replace blood loss during surgery or a serious injury. It may also be done if a person's body can't make blood properly because of an illness. And then who can give you blood? People with type O blood are the universal donors because they can give blood to any blood type. People with type AB blood are called universal recipients because they can receive any type of blood. And then another part of the blood is the Rh factor. In addition to antigens of the ABO blood system, the red cells of humans also contain an additional antigen called Rh antigen. Persons whose red blood cells contain this additional antigen are called Rh positive, and then those who lack it are Rh negative. And then this really just comes into effect with pregnancy. If the mom is Rh negative and the baby is Rh positive, the mom's body will start to produce antibodies against the Rh factor, and then the pregnancy can turn fatal. And that's it.
Thank you. We're getting this done.
Yeah, I'm going.
Yeah. Do it tiles?
I'm going. It's gonna be quick. Really quick. I'm going. There's the issue. I kind of went over.
He's going.
Oh. I got you, man. I'll make this quick. I went over to have like 16 slides, so yeah.
This is like 20 seconds per slide. Sorry, I'm not talking to you today.
You're very professional, studious.
Thank you.
The glasses and the.
All right, so I did my presentation on postural tachycardia syndrome, also known as POTS, and I chose this because my mom got it, which I'll explain later. She's fine, but like as you can see, it's not the most fun of illnesses.
She's fine.
No, she is. So what is POTS? As seen in the previous slide, POTS stands for postural orthostatic tachycardia syndrome, and here's where I kind of like break it out beat for beat so you kind of get an idea of what it is. It is known as a dysautonomia and affects around 1 to 3 million people in the U.S., and that's just an autonomic nervous system disorder. And it's whatever the ANS cannot coordinate balancing and opening and the opening and constricting of blood vessels as well as heart rate responses. So this means that a person who suffers from POTS cannot keep blood pressure steady and stable when like getting up from standing up or laying down. And most specifically when, like I said, from lying or in a seated position to a standing one. So quick changes in elevation. So here's a photo that I thought really perfectly demonstrates. So whenever you're sitting down, obviously blood's evenly dispersed, whenever you stand up though, the blood immediately rushes out of your head and goes to your legs. This is not as extreme, but it's what like Top Gun fighter pilots have to deal with, where all the blood goes to their legs to wear like those compression pants or whatever. It's because they can faint, and that's what usually happens. Like you just come extremely dizzy. This happens every time you get up like quickly, and it can be really debilitating. I think that's how you would say that. Yeah. So what are the symptoms of POTS? Is having orthostatic intolerance, and it's a condition where extremely reduced amount of volume of blood returns to the heart after an individual stands up from lying down position, and it results, like I said, in fainting or extreme lightheadedness. And another symptom is heart rate increases from, like I said, changing positions, where it would beat about 30 beats per minute, and most adults even 40 beats per minute in adolescence through the first 10 minutes of standing. So it's just like you're fainting, like you're practically going out. So then continued symptoms just on the websites, they said like severe and long-lasting fatigue, like headedness, brain fog, forceful heartbeats, nausea and vomiting, headaches, excessive sweating, shakiness, and a pale and purple discoloration in the hands and feet if the limbs are lower than the level of the heart. So I have a photo here. It looks better on the slide, but as you can see, very pale and then like very purplish, So it shows that. And then this one's actually better, where it shows the same person in different settings, like after they stand up, whatever. It can show just how the blood can pull down below and then leave and neutral out. So it's just showing that like this does affect limbs, everything, and as seen in the bottom right, it's very purplish color. So then it affects mostly women between the ages of 15 to 50 years old, but men can also be affected within the same time frame, but it's kind of less common. And since it mostly affects women, it can be elevated during stressful times, such as during pregnancy, childbirth, afterbirth, and even when experiencing menopause. But however, this doesn't mean the rest of the time POTS is not affecting them, and it actually occurs most of the time. So what causes it? There's no specific causes for a person to develop POTS, but a few factors and stressors have been linked to the development of POTS are significant illnesses such as a monoinfection or severe bacterial infections, pregnancy, physical trauma or injury such as a car accident, hitting your head off of something or falling down, surgery, and as well as genetic, you'd be somewhat genetically predisposed to it. And my mom, who experiences POTS, most likely developed the condition after giving a rough birth to my brother and having her gallbladder removed a few years later on separate things. So my brother came out backwards with the umbilical cord wrapped around his neck. So, that was fun. And he's fine now, completely normal. He's fine. My brother's completely normal. But yeah, the doctor said most likely that is what caused my mom to have POTS. Well, are you saying I'm not normal and the wrong one? I see, Dr. Stein. This is recording, for Pete's sake. Come on now. So how's POTS diagnosed? POTS is mainly diagnosed by doing a tilt table test, and this is where a person is secured to a table while lying flat, and the table is like raised to an upright position, and their heart rate, blood pressure, and blood oxygen and carbon dioxide levels are measured during this test, and that can give you practically a guaranteed diagnosis. But one might have POTS then, like I said, if all three of these are met, where it produces an abnormal heart rate response to being upright, your symptoms worsen when upright, and you don't develop orthostatic hypotension the first 3 minutes of testing, because orthostatic hypotension is very similar to POTS. So a lot of people suffer from this and not POTS, but the tilt table test puts that out, so you guarantee a POTS diagnosis. And then just here's a photo of a tilt table test where it's at different degrees for different minutes, and then all their vitals are measured. Bless you. So then it's diagnosed. Other diagnosis is a Valsalva maneuver to test Valsalva. Okay, maneuver to test the response to the autonomic nerves that control the heart. A quantitative pseudomotor axon reflex test, or QSART, to measure the response to the autonomic nerves responsible for regulating sweating. And although less common, they can also do an MRI and other imaging testings to rule out just brain tumors and other tumors. And then for treatment, there is no cure available, but many actions can be taken to treat the condition, such as increased hydration, drink a lot of water. But my mom personally loves to go and get saline solution or hydrants through an IV like every 2 months at the hospital. So there's those recovery bars for hangovers where you get IVs injected, but she just goes to the hospital and they give her a high salinity solution and She feels a lot better, so she does like once every 2 months. That really helps her out. And then an increased salt level consumed. And then, like I just said, she likes to eat like a diet rich in vitamins and minerals. And there's some medications, such as like beta blockers, or just they can help the kidney's ability to retain fluids, because a lot of the time maintaining fluids and hydration is key. My mom personally is not on any medications for it, but it is a possibility. And then just in conclusion, to wrap everything up, while POTS is an autonomic nervous system disorder that can cause many people discomfort and challenges in their everyday lives, it is a non-lethal disease that can be mitigated and controlled through a variety of symptoms and cures as well. So here are my references. I made sure to give my mom one. And then any questions? Thank you. Kyle, thank you. Thank you, Kyle. Thank you.
Two things. One, you know how on YouTube you can slow down and speed up?
Yeah.
You be on slow down.
Yeah, I know. No, because I had 16 slides. I didn't realize it was like a 5-slide presentation, so I
It
had to.
doesn't take long.
Yeah.
You always have more time than you think when you're doing a presentation.
Oh, 100%. But I'm saying a lot of slides, a lot of material. Want to make sure I didn't hold up everyone else's presentations.
Thank you. And the other side that's interesting, there's something that's similar to it, though certainly not, because this is highlighted by tachycardia. And my son gets this, that's not recent. My oldest, who's done okay with the Navy, vasovagal syndrome, which is a very, and you overreact to certain triggers, and all of a sudden now the heart rate and pressure drop. So I mean, somebody who's run half dozen marathons, and all of a sudden there'll be some activity totally unrelated out of nowhere. Sometimes he got a little excited and things like that. I think he's calmed down over the years about that. So they had to do, I forget what the workup was to make sure that it was something that did not require treatment or precluded him getting his command, because you can't have your commander all of a sudden, in the middle of combat. It's usually a problem. So it's very, the summary point is, these are when the autonomic nervous system is like your body's presets. It's very hard to reset. We don't have an easy way to reset them. So we have treatments to reset them, ideas that trigger them, and try to work around it. And it's not easy. But that's very good, interesting. Thank you.
No problem. Who's up next? Justin? Justin, want to go next?
And then, hey, we're cooking here. I like this.
You see, that's why I talked fast, because now Justin gets to go to get more people.
Yeah, well, listen, I deserve this. Listen, it's my birthright to have this, okay? Because I have it. Okay, so.
Listen.
Yeah, listen to me. Diabetes, okay? So what is diabetes? So it comes in two forms. It's a autoimmune disease or it's a condition. So pretty much no matter what diabetes affects your pancreas or how insulin affects your cells. Insulin does a number of things. The hormone that can control cell metabolism, or just like pretty much in general, like how sugars turn into energy, which is really important. So pretty much it just affects the beta cells of the pancreas. The beta cells produce insulin. That really comes with like more like type 1. Type 1 is like whenever your pancreas completely shuts down, so like your beta cells are just like done for. But one of the biggest things whenever like diabetics are like diagnosed is whenever they get to like higher numbers in sugar, ketoacidosis sets in. So it's like literally whenever sugar like oxidizes in your blood, it turns into acid. So literally your body is just like corroding at that point. So here's some like just diagram of like how diabetes can really show. Healthy person, insulin works. Glucose gets processed with insulin receptors and energy. Type 1, it's completely shut down. There's a failure before it even happens, because T cells in the body like just attack the pancreas until it literally can't make any more. And there's a backup of glucose in the body, which turns into ketoacidosis. And then type 2, the condition sets in where it's like it can be where the receptors aren't working. Glucose is like just too much glucose in the body. Like if you have like a high sugar diet, glucose can back up in your body, and insulin receptors can't take all of it in. So it just backs up in your body, and like you get like type 2. Major signs of diabetes: weight loss, extreme thirst. Whenever I tell you there's extreme thirst, you are like constantly thirsty. I mean, like, you know, like the $1 iced teas from McDonald's, how big those containers are. I drank 5 of those back to back to back, like in one sitting. Like, I mean, refill after refill. It's literally insane. And then like peeing a lot. You go like 20 times a day, like just back to back to back. Mood changes, like you can like get really aggressive out of nowhere. It's just like up and down mood swings. You're constantly tired because there's no, like, you know, ATP is not being processed properly. Cotton mouth, like every single day I woke up, it was like the desert in your mouth. Like it's just like nonstop. Like you're always drinking because like whenever like, you know, your organs aren't getting this proper insulin dosage, things swell up and your bladder is getting pushed down. So you're like always like, you know, thirsty and like peeing, and it's terrible. Don't get diabetes, guys. It's really bad. Also, type 1 blindness is actually really funny. So sugar molecules can like get to your eyes if it gets too bad. And I was in intermediate school, and literally you turn blind. Like, I mean, I would have like black flashes. I would just like see things, they would just like go blurry, and I would see black, and it would come back normal, and just like do that back and forth. It was just like, it was insane. But type 1, I have that, you know. It's hereditary. It is the complete loss of function in the pancreas. It can start off whenever you're diagnosed. There's a honeymoon phase once you're like getting insulin, probably back in the body. That can last between a couple months to a few years. Usually it lasts around a year or two. Mine was like 3 years, which is actually kind of crazy. It's just like your insulin's still being produced like slowly as your pancreas is like slowly dying, pretty much. And so like your numbers are like looking normal until after that period is done, and then you're like skyrocketing. And then type 2 can be caused from becoming elderly, obesity, or just high sugar diets. It's just the impairability of insulin not being processed right in the body, or the receptors aren't just working. For treatments, type 1, it can be treated with insulin injection. Short acting helps for like just eating meals. Every meal gets a shot. Short acting insulin lasts for like 3 hours in a time period. And then once a day you get a shot of long acting, which is like 24 hours to help like regulate blood sugar. Type 2 gets sugar pills, or like 1 or 2 shots a day of insulin, depending on how bad the patient is. And to monitor blood sugar, you can prick your finger and use a meter, or they have like, you know, technology today that helps with like, you know, just like you can like there's like Libres, you can like scan your arm and it just like tells you flat out what it is. But your average should be around 70 to 140. When I was diagnosed, my sugar was like 700. To tell you the difference. I knew a girl that was diagnosed with like 1,000. Yeah. So yeah. Any questions?
Actually, with the temporary blindness, did it affect you like driving or anything?
I was so young.
Okay.
Yeah. I mean, I was like,
So you don't get it anymore as much or anything?
no. I mean, like, whenever like your sugar is like that high, you're like, so much sugar is in your body can't process it. It's just like all over your body. So it went to my eyes. So I just like, it was just temporary. But like, once you get insulin in your body, you're fine. I mean,
Did yours? You said it was over 3. Were you like like? Did it just come on randomly, or is it like an infection, like a cold or flu or something? And
how to get it?
yeah.
So it stays dormant in your body until I didn't say this. Until a major illness hits you, because like, I don't know, it's like a trigger in your genome. Once it like, your body doesn't know it's there until it's there. Your T cells attack it, and then, you know, I got pneumonia.
Ooh.
And then out of nowhere, I started getting more sick, and then after a few months of like not knowing what's going on, I went to the doctors like 10 times, and they were like, "Yeah, it's just a virus." And I was like, "What?" And then like one day, it got so bad at a point I was turning like ghost white. And then I went to a new doctor, and they're like, "Go to the hospital like right now. Like you're gonna like."
How
Yeah.
old were you when you they diagnosed?
I was 15.
It's interesting. It's totally aside, and guy I knew, he was about 20 or 21. Great athlete. His dad played pro football in the 30s. I went to Lehigh with him. His draft number was coming up. So he knew he was going to get drafted. Over that summer, he always drank a lot of beer. He just constantly. And when he went for the physical, hoping that they would find something, turned out he made his diabetes manifest itself. He brought it on. And then at that point, he became an insulin diabetic. Diabetic. So it was an effort to try to, obviously, manage to get him out of the service. Every so often, I've tried to check online. That door might be locked.
Great job.
Oh, you got it. I thought it was locked on.
Uh-oh.
Okay, so it's interesting, the triggers that can bring it, but that's not an unusual time. Usually, I would say teen years.
Yeah. My dad's best friend, he got the type 1 at like 30.
And there's not, that's what we're seeing. Type 2 onset now because of this, what they call syndrome X, this lack of activity, terrible diet, sitting there, video games constantly, that type of stuff. And that is hard, I guess it's there's a certain amount of our folks, and I'm hardly anything athletic, but they just kicked us out of the house. But you weren't worried about somebody snatching your kids. My parents were probably hoping. But they throw you out and say, I don't want to see you back in here until dinner time. We got home from school. So for 3 hours, rain, shine, didn't matter. You went to the playground, you hung out, you did whatever you did.
Would they if you beat yourself, the kidnappers will return you? That's what I was as a
Yeah,
kid. If I got kidnapped,
exactly.
if I just was myself, they would definitely return me.
Oh, that's what my dad would say if I would get kidnapped. That's rude.
Yeah.
Because I talk to you.
Clearly, no.
I would keep you.
I think that's rude.
Yeah, who's up next? We're making time for one, maybe two.
My girl to our work yesterday.
What?
You said a girl coming to the urgent care yesterday.
Oh, really?
Yeah, she literally lost 25 pounds in a month.
Oh.
I lost 40.
Yeah, I was like, and the mom was like, oh, well, she's just being tall. And I was like, okay, well, what are you supposed to do?
What's your
She was like, well, I'm peeing every 30 minutes. And I was like,
How
how do people know?
Bells go up. Change places. We gotta get one more
I
in, please.
didn't purposely cover it.
Yeah.
All right.
Yes,
Like, over the summer, my freshman to 0 to high school. I went from 195. Yeah, I was like 35 pounds in 2 months.
I did 10 to 180.
Here we go. Another word, the static one. These are good because these are autonomic or dysautonomias are very, very misunderstood and much more common than you think. Go.
So my presentation is on orthostatic hypotension. Orthostatic hypotension is a condition where there is a sudden drop of blood pressure when a person stands up too quickly from a seated or lying position. It signals an abnormality in cardiovascular autonomic control mechanisms. So a normal blood pressure would be 120/80, but with orthostatic hypotension, it's defined as a systolic blood pressure less than 20 and a diastolic blood pressure less than 10. It's also known as a head rush. And there are two types of responses: classic OH, which occurs within 3 minutes of standing, and delayed OH, which occurs after 3 minutes of standing. So some symptoms include mental fatigue, syncope, which is a temporary loss of consciousness, tiredness, head or neck ache, and heart palpitations. So orthostatic hypotension can occur to anyone, but it's a lot more common in people of ages 65 or older, in pregnant mothers, anemic individuals, diabetic individuals, patients with spinal cord injury, and there are other factors that can induce the effects of orthostatic hypotension, such as medications like alpha and beta blockers, diuretics, and antipsychotics, and hot environments, as well as prolonged bed rest. So standing upright causes the blood to pool in the lower extremities due to gravity, causing there to be an insufficient supply of blood to the brain, also known as cerebral hypoperfusion. And the baroreceptors, which are special cells that senses changes and regulates the blood pressure in the carotid arteries and the aorta, can slow or be less efficient as a person ages. And the efficiency typically starts to reduce around the early to mid 40s. So unfortunately, there's no cure for orthostatic hypotension, but there are methods that could somewhat mitigate the effects, such as standing up slow, allowing the body to get used to and adjust to the changes in the blood pressure, staying active as much as possible, a healthy diet, plenty of fluid, smaller meals, avoiding hot environments, and there are pharmacological treatments such as fluorocortisone, which increases the blood volume and blood pressure, promotes sodium reabsorption, midodrine, which improves the standing systolic blood pressure, and pyridostigmine, which affects the diastolic blood pressure by increasing the peripheral resistance. That's it.
Very good, very good. It's just this is like the third issue that surrounds these problems. Again, autonomic dysfunctions. Anybody who gets older, if you have anybody, for you folks, grandparents, and things like that, they've all got. You see them trying to get up and start to move. Kind of you shoot a glance back way, holding. See, I do the same thing. I get up in the morning. The only time I have to do it is I just hold on to grab where the desk the computer's on. Just kind of say, okay, I'm good. So it's that hop out of bed and standing thing that really is the problem. Get up, sit for a count or two, hold on, and now the idea of these delayed ones are a little bit more scary because it can nail you when you're not necessarily expecting. So you really have to be very cognizant. A lot of and the big problem is somebody falls and then they end up breaking something. Now you're on the wrong side of that story. So anybody else for today? Or no? We got one more. You're good. That's gonna be the last thing. You saved the last one. All right. Rest of the occasion.
Absolutely. Alrighty, so I did my presentation on systemic lupus erythematosus. So what is SLE? It's a chronic autoimmune disorder caused by faulty programming of T and B cells and the antibody complexes that they produce. Inflammation is the key characteristic of this condition. It affects women and men in a ratio of about 10-1 and primarily affects women at childbearing age. It's usually triggered by environmental or hormonal factors, which is why we see it so much in women at childbearing age because of the fluctuations in their hormones. And then it can usually spread and damage multiple organs at a time. So the basics, patients usually have an underlying genetic predisposition to this condition, but it needs to be triggered kind of like diabetes before it actually manifests itself. So a variety of factors can lead to changes. These triggers then cause dysfunction in antibody-producing B cells and helper T cells. B cells then produce autoantibodies against crucial components of the body. Some antibodies that are common are nuclear autoantibodies, double-stranded DNA antibodies, phospholipids, and red blood cells. And then they can lead to a multitude of symptoms and problems. So a few symptoms, you see the typical butterfly rash in about 30% of patients. That's also where this gets its name, lupus, because it looks like the bite of a wolf back in the olden days. So that's why they call it lupus. Morning stiffness in the joints. That's usually because the antigen antibody complexes get trapped in those joints, causing that stiffness. Swelling of knuckles and joints, glomerulonephritis, which is damage to the kidneys. Damage to neurological pathways causing seizures and strokes, and then possible fetal loss in pregnant patients depending if they have the phospholipid autoantibodies. And a couple more symptoms: vasculitis, coagulation inhibition, GI manifestations like nausea and diarrhea, pancreatitis, pericarditis, other coronary artery diseases, and it can even cause Raynaud syndrome, which is pretty interesting, but very nasty disease if you get it. So the way it attacks the body, these complexes are overabundant in the body and can't be shuttled to the liver and spleen to be recycled. So they settle in the organs and other tissues, leading to more serious problems associated with the condition. The main mechanism causes glomerulonephritis to arise, which again damages the kidneys. And then other problems arise from interleukins being increasingly produced, and interleukin 17 causes the pro-inflammatory response typically seen with SLE that basically just destroys the body once it's there. And then some treatments. Antimalarial drugs like hydrochloroquine sulfate usually can be able to mediate the effects. Corticosteroids and NSAIDs are also used usually in conjunction with each other. Primarily prednisone is the corticosteroid used in this condition. And then in some mild cases, NSAIDs can usually just be enough, but normally they have to be paired with corticosteroids, and that's after antimalarials usually fail or the body starts rejecting them. So that's when you have to kind of switch to suppress the immune system. And these are my references. Anybody got any questions? Thanks.
Fascinating disease, probably second most common of the true autoimmune diseases. Major cause of kidney problems. Second leading cause after diabetes, kidney failure and need for kidney transplants. A year, or I've had any number of patients with that. Very much female predominant. There's one where it just affects the face called discoid lupus, where it has more of the facial appearance, but less of the internal structure. I don't know the interrelationship between them. It's interesting. Did they mention anything about IL-17 inhibitors in what you looked at? IL-17 is a pro-inflammatory interleukin. I took Cosentyx, and that's not an easy drug to take compared. Before I put me on the Humira, I had some responses to that. I would be interested if they tried that. So I thought that was a rough drug compared to the Humira, which is a little bit more specific. Great, very good. Great. All right, so who's ever left, get your stuff in so we can do this on Wednesday. There is no lab today.
So technically our lab's done. We're over. Nothing else is due.
Nothing else, you're done.
Wait,
All right.
I would.
No.
It would be nice if this came with a paper, or at least.
I'm gonna be so honest, mine's not coming.
You're establishing a precedent.
Yeah, no one else.
Ah.